Good evening, everybody. It's my great honor today to welcome Dr. Mohammed Al-Ahmari. First, before everything, we would like to thank our heroes in the healthcare sector, RTs and other healthcare practitioners who are fighting this pandemic. And also our prayers go to those who are affected by this illness. May God expedite their recovery soon, inshallah. Dr. Mohammed, thank you for being with us today.
Thank you so much. It's my pleasure. And I hope we're going to spend a good time to go over our future in respiratory care.
Hopefully, inshallah. Dr. Mohammed Al-Ahmari is wearing a lot of hats now. He's an assistant professor in respiratory care. He is the CEO of the Roller Hospitals in the Eastern region. And he is currently deputy CEO of the MAM Medical Complex. He's a busy man. He's one of the pioneers in the field, and he had no hesitation accepting our invitation to describe the new clinical programs in the respiratory care in the kingdom. We thank him again, and first we would like to ask him, Doctor, can you describe, please, what is the Saudi Diploma in critical respiratory care in general?
Okay. So again, thank you so much, and it's a pleasure, honor to accept the invitation and to be among you. So let's say, I spent so many years, around more than 18 years in the academic field. And one of our dreams, since the early 2000s is to start, to think about, our career in Saudi Arabia. We know with the limitation of postgraduate studies in North America and other parts of the world, also in Saudi, and we thought it would be a great move to think like other professions in the field by building postgraduate clinical programs under the umbrella of Saudi Commission for Health Specialties. So that was the idea with a group of my colleagues, many of them. So I think everyone knows the history from many occasions, we have addressed, this dream. So maybe 7 years back, we thought, let's just start with a residency program like pharmacy and like other professions. And then we thought about, fellowship program, and we had so many circles that went through so many bumps, because also the Saudi Commission went through so many changes in the last 10 years. So we came up with the idea to start something called Saudi Diploma in Respiratory Critical Care. And this is 2 years program, and it's endorsed by the Specialty Scientific Council under the Saudi Commission for Health Specialties. And it's approved also by the Central Training Committee in the Commission. So this is generally the framework for the idea. It went through so many years, unfortunately, but at the end, we success to get the approval to start building a team and to write, the curriculum for 2 years. By the end of these 2 years, we shall entitle those candidates with a senior specialist or specialist 1 in terms of classification. So this is the quick overview about the dream to start with the program.
I see. So in summary, it's a clinical program in critical care, in respiratory critical care. It's a 2-year program. By completion of this clinical program, the practitioner he or she going to be a senior specialist by the Saudi Health Commissions. Doctor, before we go in depth about this program, can you briefly also describe the difference between Saudi Diploma and Saudi Fellowship. We may have in the future also a fellowship in critical respiratory care. So
Yes.
can you, talk about the differences and what's the seniority level? Are those who will finish the fellowship will be eligible to get a consultant position?
Yes, that was the initial talk, in the early years, is how do we improve, the profession in the long term. And we know that we have a limitation, and we know that from history that we started with a diploma program. So most of the practitioners in the field in the 90s to the late 90s and early 2000s were only technicians. So with the start of the bachelor programs, we get a good number of specialists, and then we thought, okay, that's it. There is no more progression in the profession unless we go into clinical programs. And that was, again, the idea is, someone will tell me why diploma, why not residency? I will tell you frankly, we started with the name residency, but then we had so many obstacles about the name. They said, okay, so diploma or residency is similar when it comes to the classification. So that was one idea. The other idea, why critical care? We said, okay, we can do a critical care, we can do home care, we can do so many specialties, and all remember that we broke down the profession into around 12 sub specialties, critical care, home care, etc. It's in the booklet of Saudi Commission online. We can build again any program now. We can do another Saudi diploma in any of those sub-specialties. The challenge was which one of those we can really make it through, because it took us around 7 years to make one program. It's not because we did not do it, it's because of the obstacles and the changes in the Saudi Commission, etc. So yes, we can be classified. So we thought about classification to the senior specialist and to be a consultant. We are only a few, we are, I think, 3 or 4 of us in the field who has a consultant rank. So that was one of the ideas. Okay, well, how about others? How can we reach to put more consultants in the field? So the idea came about, you can do that by doing a fellowship, and they will come to the fellowship in the next few minutes. So we stopped. I was chairing, and I'm still chairing the fellowship program, but we stopped because we said, let's do the first diploma, and then we're gonna go ahead and do the fellowship. So diploma, it's 2 years. We choose the critical care, and if you go through the program, you will find the breakdown for the curriculum, and we will come. If you have any questions about the details, we can discuss it any later.
Sure.
So 2 years, it's a clinical. I mean, this makes me so excited about the start of this program, because it's purely clinical. It's like any other profession in the market. Our program is like it's a diploma, it's a residency if you want to call it. It's like physicians, it's like other allied health or nursing programs. Once you get it, you finish the certain experience, then you will be classified as a senior specialist. That's it. That's when it comes to the diploma. If you want, and it's a general critical care. Once we do the diploma, if you want to, that's a diploma. The fellowship, it's 3 to 4 years program. By the end of the 3 to 2 years program, you will be classified after completing the experience to a rank of consultant in respiratory therapy. This is the name per se from the Saudi Commission for Health Specialties. If you ask me, what do you mean by 3 to 4 years? I mean, this is not a definitive answer because we are working on it. So 2 years as general, or we are working with the Saudi Commission now to make the 2 years is like the diploma. If you have a diploma, you can add 1 or 2 years as a track to more of neonatal or only adult critical care. Or we can do 2 general years, 2 general, and then you can add 1 extra year as a subspecialties in home care, and then you become a consultant. Or you can have another track like emergency, and then you complete the fellowship. So 2 general, 1 or 2 years, we did not decide. Then you will be ranked as a consultant. So this is the difference between diploma or residency and fellowship.
So in summary, Doctor, that the fellowship, so those who are going to complete the Saudi diploma in critical respiratory care is going to be general practice in critical care. Then if you do a fellowship, it's not definite answer, but those who have completed the Saudi diploma certificate or degree, then they may be eligible to have more or like less years in the fellowship. Instead of like 3 to 4 years, maybe it's going to be 1 or 2, and it's going to be in subspecialty, either neonate, pediatric, or like maybe home care or with general practice. So it's not a definite answer for now, but in general, those who are going to complete this program, they may be eligible for a reduction in the period, right?
Yes, definitely. And the vice versa, once we get the fellowship done, because it's 4 years, they might, any candidate can do like 2 years and they can have exit and they become a senior specialist, and they can complete the program and they become a consultant. So this is also another option that we are discussing, that we have discussed in this maybe last year, but still, once we complete the program, then we have another circles, with the Saudi Commission committees in order to approve this. So let me again say what we have done is really a history. And no one have done this globally, and I know from our international council for respiratory care in US that this is something that even they are thinking to establish something similar to what we have done successfully.
It's completely true. I mean, I'm currently in the US, and every year at the ARC conference, they are discussing that how do we, push the field to another level, to advanced level. They were thinking about residency, pediatric residency or so, but they are like encountering really obstacles, especially from the economic wise and the manpower as well. So it's this is one of the objectives why we made this talk in English, that we want to, with the association, with the Saudi Society for Respiratory Care, that we want to promote the idea that Saudi Arabia established an advanced clinical program in respiratory care as one of the pioneers in the field. And this is really an advancement in the field. And we thank you, Dr. Muhammad, and your colleague for fighting to get this program to be real. Thank you for that again.
And the challenge, we have different systems than any other systems in other countries. The challenge is like any postgraduate program, when you come to the delivery, you have certain criteria for those, for those trainees, is minimum master degree, minimum of senior specialist, with a certain experience, with certain experiences. And they must be, for example, the program director must be always a full-timer for the delivery of such a program. They also require part-time trainees who should fulfill the full-time trainer also workload. You see, when it comes to the delivery, it's not really easy. Because it's similar to our university system. In order to be a program director, you must be a PhD holder, an assistant professor, etc. We have more restrictions when it comes to the delivery of any programs. So again, you can write any curriculum, you can write a fellowship, but at the end of the day, you will not have the chance to deliver it in any training center because you don't have the right trainees with a certain qualifications and full-time and other workload in order to deliver it. And this is the biggest challenge. That's why we said, okay, how many consultants we have now in the market in order to think about really doing a fellowship. That's what, for example, in Jeddah, we have one consultant. In Eastern Province, we have only one consultant. In Riyadh, I believe we have two consultants in Riyadh. So it's a big challenge, okay, when it comes now to the training center. That's something we need to understand. It's not only a curriculum design or preparation, it's also about the delivery or requirements by the Saudi Commission for Health Specialties to have around to deliver it. And that's why we are so happy and excited to deliver the postgraduate because we will get more candidates as a senior specialist. And maybe by the time we have the fellowship in the market, then we have maybe more negotiation with the Saudi Commission, especially with those senior specialists with a long experience to be full-time trainers or program directors in that case.
This takes me to the next, maybe we start some logistic, Doctor, about the clinical sites or the clinical locations. Do you have any definite answer about what are the clinical sites that are going to host this clinical program?
Wallahi, yes, I mean for the training sites there is another committee under the Saudi Commission for Health Specialties, and maybe Dr. Hajid is aware about this. Because he's the chairman for the council there. We have different also accreditation standards for the centers. So I know that Jizan, that they have submitted a request to host this program, because normally this is what will happen is centers, they apply to host the training program. And then there is another committee. They have certain standards. They come around and they want to come to make sure that this center is meeting the standards to in terms of human resources, in terms of covering the curriculum sites, and that's why you might find two centers sharing the program at the same time. So we are waiting for the results for those who applied to the centers. I know Jizan, and I know from my side in Eastern Province that we applied also to the Saudi Commission to have this program. I know that Dr. Hajid is also planning to host it in Western area. So this is what will happen. I'm not sure about Riyadh, but Riyadh we have any good centers, and I'm sure if they apply or if they already have applied, they will meet the standards.
So meaning that we may have some hospitals or like clinical sites, they may start the Saudi Diploma program before other hospitals. So yes, it depends on the clinical site.
Jizan, for example, they are so excited. I mean, they send so many requests and about hosting this program, because in Jizan they have uh, uh, seven respiratory therapists with a master degree,
Yes, right.
and I think they have 2 or 3 hospitals there. So if the committee, we're not a committee, there is a different committee under the accreditation unit. They go there and they want to make sure they meet the standards. So we might see this in Jizan very soon, in addition to other areas.
Yeah. So for non-Arabic speaker, Jizan is in the southern region of the country. Okay, just for your information. So, Doctor, now we may go to the admission. So let's say if Jizan, one of the hospital, like the clinical site, they will host the program. So is the admission going to be exclusive to their like employees, or they may
No,
recruit
no.
external candidates?
No, actually, for the admission, this program is totally under the umbrella of Saudi Commission for Health Specialties. So they
I
have
see.
their central committee, and there is a general requirement by the Saudi Commission, and there is interview for those candidates, and there will be a matching. This is similar to any other professions. You see, every year we see the Saudi Commission is doing acceptance for physicians and other professions in their program. So this is similar to their system, and there will be a matching, and then it will come there. So no, there is nothing exclusive for the training site. No.
So it's
I
similar
mean,
to other like
anyone,
clinical. Yeah, I see.
yes, I mean, anyone can apply to the program there from any area.
And Doctor, during the clinical program, the candidate or the trainee, they are going to receive a stipend from the Saudi Commission for Health, right?
Yes, yes. I mean, this is like internal scholarship.
I see.
So you will have approval from your hospital to go to get the training there. So it's like you're an employee, but with the internal scholarship. And you will apply all the rules and regulations under the central committee supervising the trainees in that area. So this is what will happen. In each area, you will have a committee, which is, making sure that they make sure that those trainees, they meet the standards, they do the training, they do the exams, etc. So so everything in this program is monitored, regulated, monitored, and conducted by the Saudi Commission committees.
I see. So meaning that if you apply for this clinical program, you won't lose your current position or job, but it's
Yes,
going to be
yeah.
as not part-time, like it's like a scholarship, internal
Yeah, yeah.
scholarship to another hospital. You go, for example, to Jazan. If you are accepted there, you finish your clinical program, then you go back to your main hospital or like
No, they
site.
call it in Arabic IFAD, like
IFAD, yeah,
scholarship.
I got you. Excellent. So, Doctor, now let's say about the requirement of admission. So, is there like minimum criteria? Let's say, are those who have, let's say, associate degree or bachelor degree are eligible, or
Uh,
clinical experience or exams? What's the eligibility, Doctor?
See, there is a general requirement. It's in the website for the Saudi Commission. But normally this is the general is like 2 years experience, and they are a bachelor degree holders. Okay, and they have valid again the BLS and valid Saudi Commission card. So the minimum years of experience 2 years, again and bachelor degree. And
So
then that's why,
okay.
and then there is another interview when they pass into the selection, they go into interview, then they will choose the candidate. So it depends now. It's not announced now how many candidates they will go to the program. For example, in Jizan, I doubt they will accept more than 5 candidates to be in the program.
Is it 5 every year or 5 during the cycle of the program?
Every year.
I see. So, Doctor, now, what is the main difference if they have a master degree and I am now a senior specialist, or I have a Saudi diploma and I am a senior specialist? So those, okay.
So there is no difference. I mean, the difference, I mean, they all can get the classification. If you have a master, you can be classified as a senior specialist. If you do this diploma, you will also get classified as a senior specialist. If you get a PhD, you will be classified as, if you get a PhD in respiratory care or any relevant like respiratory medicine or any other healthcare professions, you do your major in respiratory care, then you will be classified as a consultant. Or if you do a fellowship, then you will be ranked as a consultant. The difference is the track. This is more of school, and this is more of clinical. And this is what the Saudi Commission is calling for, is we need to have a clinical practitioners. They have training in clinical. So it's the same. I mean, the same in terms of ranks, but different in terms of the scope. And you leave this to the market, right? And we leave this to the market. If any department, he will get 2 senior specialists. So someone comes from a university or someone comes from the field, and maybe definitely they will go by someone who gets his senior specialty from the field, right?
Right.
And I think this is will change or shape the future of respiratory care.
Right. I mean, it makes more sense that those who are actively engaged in a clinical experience are more eligible to be working with patients than those who are working in academia, more like textbook and research perspective. So now this takes us to another question, Dr. Mohammed. Those who are completing their Saudi diploma in critical respiratory care, is it going to be purely clinical, or during the program they will go to the summer school and get some maybe advanced knowledge or advanced perspective about maybe critical care or mechanical ventilation or etc. So so it's going to be purely clinical, or it has some school classes?
Well, this is purely conducted in the clinical side, but I mean, it depends about the committee in that area. And for example, if you look to the program in the website, you will find we have core specialties topic. We have medical critical care, surgical, cardiac, adult, pediatric, and also we have something for quality leadership and research, right? And this is very crucial. And we have decided that any candidate must do part of his training in quality research and leadership. So we leave it to the area. I mean, you might send your trainee, for example, to the university to do a course about quality or to attend any evidence-based class or any training. So we leave this to the committee, because at the end you have assessment tools are very clear, and it's being listed in the program itself. So yes, I mean, it's someone can do a leadership class in the university. Okay, that's part of the leadership, and you get the evidence and you submit it to the program director. So that's why we left something, because we try to build, the senior specialist with not only pure critical care experience. We put something for research, we put a project, we put something for quality, and we put something for leadership.
So now, Doctor, you just mentioned the assessment or evaluation, and this is one of my talks criteria, or like the one of the questions that I was going to ask, which is the evaluation. So those who are in the program, how they are going to be evaluated, and who's going to evaluate them, and the completion of the program, is there going to be a checklist or an exam, or how the process of evaluation?
So in this program, it's 2 years, and it's been listed, and we explained, this in the program itself, that we have formative assessment tools during this program, which let the trainee be challenged or examined by the Specialty Scientific Council Committee. So again, we have a regional committee, we have a program director, we have also trainees approved by the Saudi Commission, and we have also a committee. They are responsible to make sure that all trainees, they will be assessed during the first year and second year. So we made sure that, during the first year, that all trainees, they cover knowledge, skills, and attitude. And they will be assessed by using specific academic tasks as listed in the program itself. It's in the website, and also end of year written progress test. Each year we have a written progress test. They need to do it, and also they have OSCE and DOPS, like direct observation of procedure skills. And we have the mini 6, which is mini clinical evaluation, and also in training evaluation reports. So we all trainees must go through these assessment tools in order to complete the program. Again, in the second year, they have to do a specific academic task, DOBS again, and the same for the attitude. And we put the clear fail, and less than 50 is failing, and 50 to 60 is border fail, and border pass is 60 and above. So all trainees must score 60 and above to pass the program. And the clear pass, as you can see in the online booklet, is more than 70%. And if you go again to the online booklet, which I really invite you to go through to the assessment tools, it's very clear, and we made sure that it's very clear, especially for the learning outcomes, or what do you expect from trainees to be assessed. We put it so clear, and we made sure that when no one if complete the program without proper assessment. And let me, because I also put, if you ask what is the specific academic task, we also listed that in the manual. We said, okay, we have mandatory activities, like for example, in the first year, they must finish, for example, fundamentals of mechanical ventilation in neonatal, pediatric, and adult. They must do advanced, they must do non-invasive, airway clearance techniques. These are must activities, specific academic tasks in the first year. The same with the second year. And this is how we evaluate our trainees. They have case presentation, they need to do it. We have, and we put examples. We put for example, end of the year. For example, the end of the year, they have 100 multiple choice questions. Okay, and this is comes from the bank, from the the Saudi Commission website, so they will do it there. For example, the mini clinical evaluation, it's up to 20 minutes exam with a feedback. So all assessment tools are listed. In addition to the logbook, all trainees must have a logbook for continuous evaluation and attendance, which will be normally signed by the instructor and the students regularly. So this is the assessment.
Oh, it looks like thorough. I mean, thank you for your description. Doctor, now those who are in the program or who are going to complete the program, are they eligible to perform some advanced clinical modalities? For example, I know some respiratory therapists who are performing, for example, arterial line, A line, but those in other hospitals, they are not eligible to do such. So let's say about the A line or chest tube, or maybe interpretation of, let's say, CT or something. Those are not equal in each hospital. So what's your input here?
We made sure in this program, they cover, the scope of service are clear in terms of procedures, in terms of skills needed to be done during the program. So when we say chest X-ray interpretation, I mean, again, we expect the CT, we expect the X-ray interpretation, and I think all our programs, we have one course for each for such. I mean, again, for the chest tube, if I heard you correctly, I mean, we don't do we don't insert a chest tube, right?
Yes.
So we don't, of course, we don't place something is outside the scope of our practice. I mean, for example, I think we heard a lot about, ultrasound, right?
Yes.
But still, it's not in the market. It's not within the scope of respiratory therapist. So we have no right to examine someone on something is still not within the scope of respiratory care. Again, for the other modalities, it's very clear. Basic to advanced mechanical ventilation, hemodynamic monitoring, other things, it's already listed, even each skill in the manual itself.
So to summarize, or in other words, the going advanced and with the Saudi diploma does not mean that you will increase your broader your job description. Rather than you are going to signify your skills and go deep in your knowledge, let's say, within the scope of your respiratory care practice. Right.
I mean, but again, we have the lung ultrasound. If you look to our manual, we put the lung ultrasound. We cannot neglect someone to be not to go over it, right? Yes. But we put the ECMO, and we know that ECMO is not, and we made sure that everyone in this program must do something about ECMO. So it's even there. Also, we inserted something like mass casualty ventilation, and this is something that again we made sure that transportation and the stabilization of critically ill patients, they do skills, they do any training in that part. So and that's why if you go to the program, it's really detailed. Because we want to make sure that when someone examine any candidate, they want to make sure that they get all these skills in a proper way. Something that we did not put so much emphasis, and maybe this is something we might call program directors to reconsider. This is the infection. Okay, with this pandemic, I think we have to reconsider putting so much emphasis and training with infectious diseases.
Right. Makes sense. So for our attendees in either in Zoom or Twitter, please, if you have any question, put it in the Q&A or in the comment section for Dr. Muhammad. Here maybe I have last question, Doctor, is do you have an anticipated time frame when we are going to see the first maybe announcement for accepting candidates?
I think this is like any other year. I think in October or November they open. This is the annual opening for with other programs. So the opening is similar to other programs.
So we may have something in this year, like this the next
the
academic
opening.
year.
I think end of this year,
Okay.
and the first start in I think February 2021.
So it's really close. Okay.
It is.
Really
it is
exciting.
I mean, for us, having this program now in the Saudi Commission website, it took 7 years.
I can't tell. I mean, even the document itself, it was well written, and the writing of the document with these details and revision without thinking about the details is really a headache.
I mean, again,
so,
this program went through so many committees, and it's not only because also the curriculum supervision from the committee. They have experts from their side, and those experts, they want to make sure this program is like other programs in CAM-MID framework. So it took us a long time to put, also our program into CAM-MID, framework.
Well, before I go to the question, I may have just some quick note that last week I spoke with Dr. Hajid Al-Ataibi, and he explained the history of the profession. He said, imagine that in the first generation of the Saudi respiratory therapists graduated from Saudi program was in 2002 or something, or 2000 from Dammam University. It was almost 18 years ago. So during 18 years ago, the advancement of the field or the advancement of the profession, now we are going to have a Saudi diploma. It's a local program. You won't need to go abroad to study a master's degree. I mean, it's a local program, it's a clinical program, it's really an advancement in the field. We may have some rumors that there are some negative thoughts about the field, how it's neglected or so, but within 18 years, we may start having a local training program that nobody in the world did it. I mean, no in United States or Canada or Philippines or India. So this is really an advancement in the field, and I salute the efforts of Dr. Muhammad and his colleagues for doing such an advancement in the field. So I thank you so much, and I really thank you again, Dr. Muhammad. This is really a great advancement.
Thank you. But let me make the first batch, graduated in Saudi from local program. It was in the 90s.
I mean, a bachelor degree.
Then it took us 10 years to have another program, the bachelor. Then it take us another 11 years. Okay, see, every 10 years we have. Then it took us another 11 years to see other programs to come in the field. Right. So then it took us around 8 years or 7 years to see a postgraduate diploma. And I hope we don't repeat another 10 years to see a fellowship. I know that our colleagues in India is doing an amazing job for the respiratory care development. So we might see also a fellowship maybe in India soon. And I know from being with them for the last few years that they are doing an amazing job, not only at educational level, but governmental level, to have that profession to shine in their country. So I think India is coming big.
Do you think that, let's say, our colleagues in the Gulf region are eligible to apply to this program? Let's say from Bahrain or Emirates?
By law, they are eligible, yes.
I see. So they may consider applying to the program. This is the news, to host either an international training program in the region as other like medical program. So I will go, Doctor, now to the Q&A and the questions. First, Khalid Al-Qahtani asked about if those who have associate degree with experience are eligible or not, and you clearly identified that the requirement has to be a bachelor degree with 2 years of experience, right, Doctor?
I mean, because it's very simple. This is a requirement general requirement by the Saudi Commission, because technician, the associate is a technician, and you cannot go from a technician to a senior specialist without a specialist. So it's
another question that that about the advanced practice, let's say just a tube or so, and you have explained this as well during our discussion. So the next one is from WIAM. Any centers in the Eastern Province are ready to host the program, Dr. Mohammed?
I mean, being the CEO, I mean, we have the new health cluster in the Eastern Province, and yes, we will host it in the Eastern Province, inshallah.
Inshallah.
We have enough centers in the Eastern Province. We have a good number of manpower to run the program.
I think, Doctor, Eastern Province is the most experienced, and it should be the more eligible centers there, because the infancy of the profession started there. I mean, in the 90s.
But again, it's about now the availability of ranking, or of classification. If you don't have enough people classified from the Saudi Commission as a senior specialist and consultant, then you will not success to have the program.
I see. Another question that, do you know, Dr. Mohammed, how many centers applied so far?
I'm not sure, but I mean, I know ourselves in Eastern Province and Jizan.
I see.
But I'm not sure about others.
Another question from Shammari. Are you going to consider the applicants from each region? Let's say if those are, let's say, from Jizan or from Riyadh or something that, is there going to be a distribution from regions, or depends on the applicants?
I mean, if you ask us who wrote, this program is our job is over. And now there is another, comes back now to the Saudi Commission, because they will have their admission committee. They will tell us, maybe they will select us, maybe not. But again, there is no, I mean, everyone will apply, and it depends on how many seats in that centers, and then they will do the matching system. So that's the process, okay? So they will, that's the process. So let's see how many centers we have, and they will decide how many seats based on how many program directors are available and trainees, because the Saudi Commission will contract with those centers, and also they will contract with the program directors, with the trainees, with the local committees. It's not an easy process. It's,
for sure.
Yeah, it's a program.
So meaning that the number of seats are going to be, or it's going to depend on the site capacity and the site location, the number of beds in each hospital or site. Okay. So it's something, it's going to be variable based on the clinical sites.
Yes, we will hear the news maybe by October and November.
Oh, Great. So. The next question, Dr. Mohammed, what's the requirement for an institute to host a program? I mean, for the clinical site itself, is there a minimum requirement?
Again, there is a committee, and they go through the standards. For example, if you see our program, you will find we have neonatal, right, and pediatric, etc. So they want to make sure, and in this hospital they do service for neonatal and pediatric, right? They have the cardiac critical care, they have the surgical, etc. So they want to make sure this is from the site and perspective. They want to make sure that they have academic and training, okay. So let's say hospital A, I mean, for example, in Eastern Province, we applied for this program. We have one hospital is doing neonatal and pediatric, so this is fine. So we will have one rotation in that hospital, and the other hospital, he will do the other rotations. So our candidates, they can rotate in different hospitals accredited by the committee to complete the program, like physicians in their programs. The other requirement is the trainees, full-time program director, and also the trainees around. Okay, so they require, for example, in each center they have a senior specialist, someone like with a rank of senior specialist. So technically those with a master degree.
So here another comment or like question that about the if those applying to the clinical programs, they are going to study. I mean, they are not going to study abroad. I think, Dr. Mohammed, you have clearly identified or like you answered this question that it's a local program. It's not an abroad program. Another questions about the fellowship. Is there any time anticipation of the fellowship? And you have answered this question that still it's in the preparatory phase. There is no anticipated time when the fellowship will be, it's going to be real, right, Doctor?
Yes, yes. And we actively now, we start now to we will resume the fellowship committee after Eid, because everyone is stuck with the COVID.
Yes.
19, but hopefully in the next few weeks we will have a recovery plan for all services, including the fellowship.
And another question from Nasser. He said about, and this question is really valid, that the kind of task that for the senior specialist after completing the Saudi diploma in respiratory critical care or critical respiratory care. So are the kind of profession or like kind of work is going to be different? So do they have some kind of eligibility, or what's kind of their work going to be?
Let me go back to the history.
Okay.
One of the challenges or problems in profession is the scope of practice. We started as a technicians, and technicians, they can do everything. And this is similar even in medicine, and you can have someone to do everything. But this is not the type of true scope of practice. You will find more subspecialties. You will have more expertise in certain skills. So this is similar in terms of concept. You can have someone dedicate his expertise and skills in adult ICU, for example. You can have someone expert in neonatal and critical care area. And we remember from our practice, you have someone who is covering everything. He goes to the new NICU, from the NICU, he goes to the pediatric ICU, then into the emergency. And this is kind of, I always see it unsafe or not focused scope of practice. Now we have you know, with the with the COVID-19, that we have learned the importance of having respiratory therapists dedicated in the emergency room with more different skills, right?
Yes.
Because he's dealing with the frontline emergencies. He will have different skills than someone in the ICU. So again, I mean, if I elaborate more, okay, we need to have someone who is dedicated with his skills in pulmonary rehabilitation, etc. That's one thing when it comes to the skills, and you cannot master all skills. Okay, that's impossible. The other thing is the supervisory level, leadership level. This is a requirement. You have to have someone with more qualifications, someone with more classification. It's a leadership in the market of now with the new transformation. So I believe, yes. I mean, I can tell you the joke that we can do anything, but I think this is no more. I think the new transformation in the healthcare leadership is to have true skills, is to have focused skills, and to have more really dedicated experts in certain areas. And I suffered. I'm a CEO for 14 hospitals now, and I can see how bad that we don't have focused our respiratory therapists in certain areas. In rural hospitals, where some hospitals didn't have ICUs, right? And they don't have respiratory care in their hospital. So what is the point for not having a respiratory therapist in those hospitals because they didn't have ICU, but actually they have casualties in the ER.
Yes.
So we have casualties in the ER, and we have traumas in the ER that they need to be, they have to have airway management, advanced airway management, and mechanical ventilation. So where are the respiratory therapists in the rural areas in the emergencies department? And in January, before the pandemic, I started with the ICU model in the rural areas, is to have the ICU model in the ER. And then I recruited respiratory therapists in the ER only. So all of a sudden we get the pandemic, and we find how successful to have respiratory therapists in the front line during this pandemic in the ER. So I think this is very crucial, is to have any respiratory therapist in so many areas.
I agree. It's not like respiratory therapists is stuck with ICUs rather than we care for medical conditions, and it could happen in home care or like ER or even the clinics. So the horizon of our profession is more than just an ICU. ICU is a critical part of it. To have some horizontal also, let's say, disciplines that we work in. So, Doctor, there is a question here. Those who have now a master's degree, are they eligible to apply, or even during in the future, hopefully, for the fellowship, are they eligible to apply with their master's degree? So where the program stands for those who have a master's degree?
I mean, why a master? I mean, the question, why a master degree if he is classified as a senior specialist to go for this program?
Yes.
I mean, again, I mean, you can have it, you can do it. I mean, we have so many degrees in different professions or in the same profession. But if someone has a master degree in something not relevant to the respiratory care, then technically he would not be classified as a senior specialist. And we know this from the market, is that we, from the Saudi Commission, is we have so many so many professions with the master degrees, but they actually are not qualified. I mean, they are not classified as a senior specialist because their masters are not relevant to their professions. So yes, if someone has a master not classified, then this program will give the candidate classification to the senior specialist.
So we had another.
But let me add this point and take the physicians as example. You will find them, they have a fellowship in critical care and internal medicine. They have a pulmonary fellowship and critical care, right?
Yes.
It's the same. It's the same concept. So that's the same model.
We had another question here also about who's working in the academia. I think you have answered this question now. Maybe I have now last question, Dr. Muhammad, about what's your, from your evaluation, you work in the leadership position now, even as a CEO. What do you think? How many centers are eligible in the kingdom in the future? Do you think how many centers or how many regions are eligible?
I think Eastern, Central, and Western. They will. I think we have. I mean, it depends if they apply. They will have it, especially in the Central region. Eastern, I'm sure that we can have it. Western, I'm sure they can have it. Okay. So, and again, history repeats itself. If you take our history as example, every 10 years we have around. So I think this is the same. This program will have a huge impact in the profession. Definitely, because it's under the umbrella of the Saudi Commission for Health Specialties. That will give anyone a ranking, to the senior specialist. Someone has a fellowship, he will become a consultant. So I'm very definite that people, there will be high demand to such programs. So the queue will be long.
Inshallah. I am done, Doctor, with my questions. I thank you again for for accepting my invitation. Any final words?
Thank you so much, Abdullah. Because you made this happen. You are so active to put all us together to speak to our community. I'm optimistic. I'm so honored, happy to see this dream comes true. I started as a technician and I finished as a consultant, and I can see the same future, and I can see the fellowship coming very soon. Again, respiratory therapists become leaders and they become powerful in the market. Dr. Hajid is also the chairman for the Saudi Commission Council. So he's a very powerful guy inside the Saudi Commission. I'm chairing the fellowship. We have good friends around in the market. We have PhDs like you in outside the country. So I can see the profession is progressing. My advance, my just recommendation is, as a profession, we just need to think about our model. I don't think there is any other country is progressing like Saudi now in the respiratory care. So our model is the model. We feel proud to see our future is lighting. I just, sorry to take more minutes. I just would like to invite you also to look to the new Vision 2030 for the healthcare. There is something called the new model of care. So this model of care requires more skills, and the specialty and the respiratory care profession is very crucial in this model of care. I had meetings, this morning for the allied health in the Eastern Province, and I was telling them how happy to see master degrees around, PhDs classified, because we can do we can progress more and more in the profession under the new Vision 2030, and inshallah.
Inshallah. I can see that the prosperity of the field in the future, inshallah.
Inshallah.
It's a matter of time. Sometimes what you need to buy is just time. Thank you again, Dr. Muhammad. And a final announcement: next week, next Wednesday, we are going to talk about the startup companies in the field of respiratory care, the entrepreneurship in the field of respiratory care who are interested in the private sector. With Mr. Atallah Al-Arifi, is entrepreneur in the field of respiratory care. So be in the lock for the next week, inshallah. Thank you all for your attendance, and this talk will be uploaded to YouTube as well for your knowledge. Thank you all and have a good week. Bye-bye.
Thank you so much. Thank you.